and I think I was asked to talk a bit about application of machine learning to solve One Health issues. So again, my name is Belkhiria, and I work for the University of California, Davis One Health Institute. So the UC Davis One Health Institute, as probably previous presenter shared with you, focus mostly on solving complex issues for animals, people, and the environment. You can also check our website, Twitter, Facebook, or Instagram. You'll find a lot of our work in there. So as Laia just presented, I worked with the One Health Institute with the USAID-funded PREDICT project, which was about disease surveillance, viral surveillance, identifying viruses that were known. And now I'm currently working with a USAID-funded project called One Health Workforce Next Generation, which focus mostly on capacity building for One Health topics and public health in Africa and Southeast Asia. Okay, so I hope you can hear me well. This is what the menu for today. So I wanted to talk about machine learning, demystify it a bit. So the what, the why, the how, the where. Try to connect machine learning and One Health issues, perhaps provide with some examples, challenges that we usually face when we are trying to run machine learning algorithm with One Health problems, and then I will conclude. Okay, so let's start with machine learning. So what is machine learning? Well, machine learning is really a set of algorithms that are used by softwares and applications so they become more accurate in predicting outcomes without being programmed to do so. So they learn by themselves from basically historical data and input data to generate new outcomes that the machine haven't seen at all. So, I mean, one could ask, where is machine learning commonly used? Well, the real answer is everywhere. You can find it when you're checking for your, video provider, when you're doing your shopping, even CAPTCHA. So when you're trying to log into some of your websites, going to the airport, and also sometimes you don't really realize that machine learning is there when you are using your credit card. So why is it so important? Why everybody is talking about machine learning? Well, it's as I said, used by a lot of companies such as Facebook, Google, Uber, all the companies that are using technology nowadays. And it gives them a view on trends, behavior, business operations, and helps them predict outcomes and support them develop new products. So the competition is very high now between companies to get the most accurate algorithms and most accurate predictions to basically win new markets. And really, the way it works is very simple. What you're doing is similar to how you train a kid. So you bring in a set of pictures of animals for a kid, and you try to teach him how a cow looks like, and then the kid would make mistakes, and then you would redo it again and again and again until it gets into his memory. Well, it's the same thing with the machine, with your computer. You will try to show him some data and tell him, okay, this is a car, and then you would repeat that again, and your machine, your computer will basically learn that. It's more complicated than that, but I'm trying to make it as easy and as close to real examples as possible. Okay, so basically in real world, how it works, you basically have to get data. And that data can be collected in the ground through surveys, through apps, through anything that you would run teams to go on the ground and try to collect it. But you can also get it from free open source data sets that are available online. The next step would be to take that data and set it up and clean it and prepare it and take out any extra data that you don't like, so you can put it in your machine, train your machine, so get it to learn similarly to what I explained in the previous slide, and then you'll get some output. That output, you have to validate it, you have to look at it to see if it makes sense, and then once you validate that data, then you bring it back to your machine to improve it. So it's always a loop, it never ends, and you're always trying to improve and make your machine learn better and be more accurate. So I'll take the example of Netflix. So Netflix use machine learning to get you a list of movies that better fit your taste. And the way it works, very easy and very simplistic, is that Netflix would get information about you. So let's say your gender, your age, the country where you're from, the language that you speak or you're familiar with, and we start providing you random movies, and you will start picking some movies, and that's really the data that Netflix would use. Next step is that it would collect that data. So the team at Netflix would collect that data and make it in a way that is easier to analyze via computer. So let's say an Excel sheet or a giant data set, and then we put it in the machine, try to teach it, okay, this person likes these kind of movies, let's say action movie, Batman or whatever, in this language. And then Netflix would come up with a list, right? A preliminary list. And we all know that perhaps the first time that you use these movie providers, it's not as accurate, but the more you do it, the more the machine would learn. So basically, that would be some criteria such as your browsing habit, your movie selection. Did you finish a movie? Did you like the movie? Did you give it a thumb up? And that would come back to the machine to try to improve its algorithm and provide you with better movies. So in any case, the user, so the human, only provided the algorithm and the data, and the machine really did all the work by filtering, sorting, and making a decision at the end of what kind of movie it is. So, one user could do it. So a human being can replace a machine, really, but when you have a lot of data, a lot of users at the same time, it becomes so complicated that you can't do it. You need an army of people, and that could be replaced by a machine. So that's really the beauty of using machine learning, is that it replaces a lot of users, and it's much faster, much accurate, and it runs by itself. So now, if you want to try to connect machine learning and One Health, how does that work? How can we apply machine learning to One Health? I think there is no need to go over and define what's One Health, but I want to tackle right away what's the issue with machine learning and solving One Health issues, and how can we do it? Well, One Health issues are complex, so we have various sources of data. If we think about modeling, so you have human data, animal data, environment, and other multitude of types of data. There's a change and variation in time and space, and you need to have a good understanding of your pathogen. There is a multidisciplinary team, so you can have MDs, DVM, and environment, lab, field, computer science, and perhaps data analysts. And really, to summarize it and make it very simple, the way I would look at, the example on Netflix would be similar to One Health issues. So you would have essentially data, and that data could come from people, such as, again, the age, sex, disease status, location, human activity, such as movement, or, activities. Animal could be, the taxa, the species, again, age, sex, disease status, and the environment, it could be temperature, humidity, land cover, greens coverage, and all that. And really, you would use this exact same algorithms that, are being used in economy, in, computer science, on Netflix, really, and card frauds, to try to make outputs that are important from a One Health perspective, which are basically classifications of, per se, disease or not disease, creating some maps predicting areas at high risk of a disease, or trying to create a network of contact, similar to what we've seen perhaps in some examples with COVID-19, how contact patterns are created. So I'll give you an example of something I've done in the past, back when I was a PhD student, which is creating a risk map for highly pathogenic avian influenza in the US using a machine learning algorithm called maximum entropy. So really, to summarize it, avian influenza could be either low pathogenic avian influenza, which goes undetected really in wild birds, but also a highly pathogenic avian influenza, which really causes massive socioeconomic impact and animal and public health issues. The trick is that the low path could mutate to a high path virus. That is not well understood, but it happens. So yeah, high path is global. In 2014, 2015, we had in the US the biggest epidemic in history, and it was all over the news. And it caused really a massive disaster for people in the US. So the idea of my project was really, if we can predict high path outbreaks in the US, and perhaps we could be better prepared to it and reduce really the disastrous impact that it causes. The trick is that data on high path is not easy to get. It's highly confidential. It's really difficult to predict mutations from low path to high path. So what I wanted to focus on mostly was low path avian influenza, and say, okay, since it can mutate to high path influenza, then can we predict areas at high risk for low path and use it as a proxy to say, okay, any place where it's suitable for low path, then might mutate to high path. The data is more available, and it's easier to get. So the objective was really to create a low path risk map, identify potential risk factors, and then basically how good those risk maps identifying areas for high path. So for that, I used a model called the maximum entropy model. I used data from an open source called Influenza Research Database, and I'm sharing the link there. So I had data from 205 to 215, where publicly available you have the location, the GPS locations of low path positive confirmed wild birds. And I used some predictors that could help me predict where those cases are happening. So these could be animal data, environmental data, but also human activity. So where the poultry farms are, where the duck farms are, and so on. I used also migratory birds. So basically where the density of these birds are. And one might think that these data are in an Excel sheet, so I tried to convert them to what we call a spatial format, so maps and big, matrices of numbers that later on I put in a model called the maximum.
Okay.
Yes.
I think we still only see your first slide.
Really?
Yeah.
Oh my God. Okay, let's try to share again.
I can share the rest of the slides with the participants in email later on today for what they missed.
Okay, let's try to share again. Can you guys hear me?
Yeah.
Okay. So what should I do? Should I start from the beginning, or should I
Just
go
keep
again?
going. I think we still got the gist of what you were saying.
Okay, can you see my slide now?
Yes.
Okay, can you see the animation going?
Yep.
Okay, awesome. So just so we see it. So basically, I took my data. The model is a maximum entropy. I used some available data, climatic and bird and animal data. transformed it to maps, and then put it in my model. And then this would give me a risk map and some high important predictors that are linked to low path avian influenza outbreaks. The model is super simple, so it takes a coordinate of the locations where we had the diseased birds. It looks at the predictors and say, okay, let's say that all my positive birds are in low altitude and high temperature, and then it can create a probability and reflect it over a spatial distribution, meaning a map. So this is the map I got. So this is a prediction map where the color varies with areas at high risk for avian influenza. So as you can see, we have some areas in California, but mostly in the East Coast and Midwest. Most important variables were altitude and land cover. So low altitude and areas where there were swamps and lakes, most importantly. The way I validated my map and checked if it made sense or not was really to see if these areas matches with where we had high path outbreaks. And those are the green dots that you can see in the map. I hope you can see them. and areas that were at high risk really fit in, as you can see in the map, with high path areas. So the detection rate was about 83%. So out of the 312 high path outbreaks, I was able to detect correctly 258. Okay, some other examples of machine learning and matching with some One Health issues, and you can see them in the One Health Institute website. Is, for example, detecting wildlife illness and death with an early such as spatial temporal invasions. So basically looking at, I'll try to go again and present how machine learning and One Health fit in so nicely. Just a summary really quick, One Health issues are complex and they have various data sets. There are various challenges in space and time, and there's a good understanding of pathogens, and then it's a multidisciplinary team that works all together, which brings in a really good data set from a human perspective, an animal perspective, and the environment. So from the human perspective, it could be land cover, age, sex, disease, human activity at the animal. It could be taxa, gender, disease status, and the environment. It could be land cover, temperature, and humidity. The algorithms that we are using are almost the same as the algorithms that are used in economy and computer science, but the outputs could be interpreted differently. So disease or no disease, or predictions of disease maps, so areas at high risk of diseases, but also networks. And here I'm showing an example where when I was a PhD student, I used a machine learning model called the maximum entropy to predict areas of high risk of avian influenza outbreaks. So really, avian influenza could be categorized as a low-path avian influenza virus, which is almost undetectable and goes in wild birds, but also high-path avian influenza, which has worldwide distribution, massive socioeconomic impact, and animal and public health implications. So in 2014, 2015, we had the biggest epidemic in the US history, and it was all over the news. And number-wise, it was a lot of jobs lost, millions of dollars, and decrease in production of eggs and so on. So it was terrible for the country. And then came up the idea for my project, which was, is there a way we can predict high-path avian influenza outbreaks in the US? And really, the data on high path is very rare and scarce. So we had to think about another way, which is basically use the low path data from migratory birds and perhaps use it to predict areas where high path avian influenza outbreaks would happen. So the objective was create a low pathogenic avian influenza risk map, identify potential risk factors that are linked to low path avian influenza, and then see how good it is to predict areas where high pathogenic avian influenza could happen. For that, I used a model called the maximum entropy model, which is also used in various disciplines such as economics. And then I used free available data to train my model. So I used data from FluDB, so the influenza research database. From 2005 to 2015, we had GPS locations of 7,714 positive birds. The predictors I used, I also included, environmental factors such as climatic, topographic, and bird data on bird density, such as migratory birds, but also where the farms are, where people are farming. So I transformed that data from Excel sheets to a data called spatial data, so maps, that I entered in my model to basically create a risk map and detecting the most important predictors. So the risk map would show me areas at high risk for low pathogenic avian influenza. Really, the model, how it works, it looks at occurrence of the birds that have a disease and check, okay, what are, how does that fit with the predictors that are showed? What are the predictors that are highly linked to the presence of the disease? And then from there, create some probabilities that could be used to create a prediction of occurrence of the disease. So the map is here, and you can see that areas with red, dark red, are at high risk of low pathogenic avian influenza. So it's in mostly East Coast, Midwest, and a little bit in the West Coast. We found out that altitude and land cover are linked to the presence of the disease. So more specifically, low altitude and areas with land cover can basically have high chances of having the disease. So to validate my model, to check if really we can detect high path, what I did was to check basically the outbreaks, the highly pathogenic outbreaks, the disastrous disease, and see if they fit in my map in the high red zones. And really what happened was that my detection rate was 83%, where I was able to detect 258 outbreaks out of the 312. Outside of my work, there are a lot of researchers that are doing that as well. So detecting wildlife illness, checking spatial temporal invasion dynamic of SARS-CoV-2 in the UK. So there is a lot of research, a lot of work out there. Now, the machine learning challenges is that the machine is really a beast that we are trying to feed data, to teach, to learn, and sometimes the machine won't learn properly and would spit out a lot of mistakes and a lot of errors. So we have to be really, really careful on how we make an interpretation of the results from a machine. So because it cannot fully describe how the One Health problem, the complexity of the One Health problems, it really requires a lot of data in terms of quality and quantity. And then once we get a result, someone has to make sure that it makes sense from an epidemiological perspective, from a One Health perspective. So really making sure that the data is good and the results make total sense is really important. So basically, once we got some good data, some good results, and making an interpretation of them, we have to share that results with the population, with politicians, with farmers, with everyone, and we have to make sure sometimes that it's really understandable and we can use it properly so we can make sense of it. to everyone. To conclude, I would like to say that yes, machine learning is fantastic. You can use it in various apps, in various websites, and predict. But we really need to keep in mind that the machine is really, it's a service of people and not the other way around. So you really have to be there and watch closely and monitor what you give to the machine and the results and how to make interpretations from it. And with that, I hope that you were able to follow my slides, and I hope that we can conclude. And if you have any questions, please let me know.